Oh, yeah. Hello, I'm Olivia Moran, and today I'm joined with Michelle and Ston.
Hey, Olivia.
Yeah.
Hi. So today I'm going to talk about healthcare policy in the United States. So picture this. You're a young, single mother of three who's living paycheck to paycheck. You figured out the perfect budget for your family to go month by month, but you don't really have any extra money left over in case there's anything that goes wrong. Your youngest son starts complaining of a toothache, and you have to decide whether to take him to the doctor and pay for that visit or pay the water bill. While this sounds like a horrible choice that no parent should ever have to make, it's an unfortunate reality for a lot of Americans today. It's difficult to envision a healthcare plan with no setbacks or roadblocks, but the reality is simple. As Americans, we pay way too much for healthcare. Even if you can't afford it, should you really have to spend your hard-earned money on something that should just be a fundamental right? According to the Peterson Kaiser Health System Tracker, a nonprofit who aims to spark discussion about the performance of healthcare, other wealthy countries spend about half as much per person than the US. You would think, okay, so we pay more, we must be getting a higher quality of care. Actually, that's really not true, as these countries usually have about double the amount of physicians per capita than the United States. Most of these other wealthy countries also have free or low cost healthcare, and they have far less debt than the US. And according to a report by the National Research Council and Institute of Medicine, which is one of the national academies, America is far less healthy than a lot of these other countries, and our life expectancy on average is a lot lower than these other countries. Being healthy should not be for sale. The Declaration of Independence, which is one of the documents that America was founded on, says that humans have certain inalienable rights, among which are life, liberty, and the pursuit of happiness. How can we say that these rights are truly protected if we can't even afford to be healthy? Now, there's been a lot of debate on this topic in particular recently. However, I think it's time to come together, not just as Republicans and Democrats or Trump supporters and Trump critics, but just as Americans. I propose that reasonable and affordable health insurance should be offered to all Americans, and those who wish to receive coverage from private insurers may certainly do so by upgrading their coverage and paying a little bit extra. As I said, healthcare is a fundamental right, and I think every American citizen should be required to have health insurance. In the long run, it will certainly improve the health of our country as a whole. As of right now, citizens are not required to have coverage, and they would have to pay an exemption fee if they decide not to purchase health insurance. However, starting in the 2019 plan year, there's no fee or penalty for not purchasing health insurance. So, with nothing discouraging people, the people who are not going to be able to afford or pay for health insurance will end up in the emergency room. And when they receive the care, they're not going to pay for the result. Other Americans and the hospitals are going to have to make up for it by paying a little bit extra. Well, not really so little, as USA Today reports that in 2010, hospitals paid $40 billion in uncompensated care. Researchers at the University of Michigan studied the expansion of Medicaid and found that when more people were covered, these uncompensated care costs dropped by 50%. Without health insurance, some people may not visit the doctor regularly or even when they are mildly ill. And so the issue begins when their illness is so bad that they have to go to the ER. And what started as just a toothache has escalated now into this really infested and gross infected abscess. And that costs way more to treat than if it were just a toothache. It's a vicious cycle, and a lot of the diseases that kill thousands of Americans every year can be prevented or treated if they're caught early, which can only happen if someone is able to go to the doctor. When someone lets their illness go untreated, it can get so bad that they are not able to go to work, and therefore they can't earn any money. So obviously then it makes it a lot harder to pay the medical bills, and even if they can, they probably won't have as much food left over for food or just everyday necessities, paying bills, things like that. So especially when people already don't have a lot of money to begin with, this can really cause a lot of tension for them and their families, as they will be struggling a lot more once this um, kind of is thrown into the mix. So even if, um, sorry, while we are suffering and dying, these insurance CEOs are profiting off of our suffering. According to the National Public Radio, which is a nonprofit radio organization, 113 of these CEOs earned $9.8 billion cumulatively since the Affordable Care Act was first enacted. On average, one of these CEOs makes about $20 million per year, which is a ridiculous amount considering some people have to choose whether to feed their family for a week or pay their medical bills. So once again, I say healthcare should not be for sale. It is a right that all of us as Americans deserve. And those who wish to purchase from a private insurer may do so. They still have that option, but they're going to need to upgrade their insurance and pay a little bit extra for that. So let's make our country healthy. Let's let all the hardworking Americans enjoy their life and their family and not have to worry about letting their family struggle and not being able to provide for them while they're sitting there just, dying of all these diseases that easily could have been prevented if they had just visited the doctor. Thank you for listening.
So, Olivia, what kind of quality of care would you say that our healthcare gives?
Well, it's pretty good considering we have some of the most highly educated doctors around the world. We have pretty good quality of care. The only thing is, as I mentioned earlier, we have a lot fewer physicians per capita than these other countries, so it's a lot harder for people to have access to them. And then as well, that whole cost element that I was talking about, it's really hard for people to be able to pay for the care. So it's not so much that we don't have good doctors or anything like that. We certainly do. It's more of that accessibility aspect.
Cool. And you say that a lot of people, when they don't have health insurance, they'll avoid going to the hospital. How much is the average price of like a hospital visit in the U.S.?
The average price of a hospital stay?
Yeah.
Well, I'm not sure about the average price, but I'll just give you an example. So I did a study abroad in Germany, and I actually broke my ankle there, so that was no fun. So I went to the German ER, and they did X-rays, they did the whole shebang. They gave me a checkup, everything like that. They gave me a little boo and sent me on my way, and I got the bill a couple months later, and I'm not even a citizen of Germany, nothing like that, just visiting. And the bill was only about $100. Whereas if I were to do all that in the US, go to the hospital, have X-rays, everything like that, it would be about $600. So it's definitely a considerable difference.
Yeah. So how much would you say that like Americans pay for healthcare?
Sorry, I think it broke up for a second. What did you say?
How much would you say that Americans pay for healthcare?
Oh, okay. So this is one of the statistics that I actually looked at when I was doing research. So on average per person, Americans pay a little bit over $10,000 a year, while these other countries are only paying about $4,000 or $5,000 a year. So it's almost double, really. So that is definitely a huge difference, I would say.
Yeah.
Sorry, I had a meeting because there's a train that came by. So because so many other countries have already gotten a free or a cheaper healthcare system, what's the reason why America still has a really expensive healthcare system? Is it strictly based in capitalism, or or just like why is it so expensive still?
Yeah, I would say that's actually a really good question. I think that it's definitely due to our kind of system that we have, the capitalism kind of thing. So as I mentioned earlier, these insurance companies are making a ton of money off of all of these issues that Americans are having. So they really health insurance because they're not going to be making $20 million a year anymore. So unfortunately, because they have all this money, they have all this power, and they can actually lobby against free and affordable healthcare. And so unfortunately, it's going to be really hard to get that enacted because they just have so much control over that and are really not willing to give up these giant salaries that they're getting. So.
Cool.
You also mentioned how like you didn't want people to be like Republican or Democrat or like Trump supporters or Trump critics, and you wanted everyone to just be like America. How do you think that everyone can come together as a whole and like everyone kind of like pay the same cost or prevent certain things from being what they are?
Yeah. So that was something I definitely knew going into this topic. I knew it was going to be kind of difficult to toe the line of being overly political with this. So I tried to really keep my suggestion kind of in the middle with still keeping those private insurance companies around because some people may want that option. They might not want the government option. But I think the reality is that healthcare is a right. And I think that as Americans, we deserve to be healthy. And I just think that this would be a good kind of compromise in a way because I'm not saying let's make it completely free for everyone. I'm just trying to kind of keep it down the middle and support both sides. But I think even people who may not traditionally agree with affordable or free healthcare, I think we can agree that the current system is really not working, and Americans do deserve to be healthy. So I think that's one thing we can all agree on.
I agree. Yeah.
Is that it?
I think that's all for me.
Yeah, that's all for me. I thought you did really good.
Thank you guys so much.
Thank you. Bye.